can't tell you what an honor and a privilege is to be in Omer Reed's house. Thank you so much.
My privilege.
Oh my God.
My privilege.
Honored as Alumnus of the Year, University of Minnesota, following the 14 years as Adjunct Professor of Ecologic Dentistry for 9 years at the University of North Carolina, Chapel Hill, building a bridge between the student and the postgraduate. Serves on the editorial board of The Independent Dentist, a United Kingdom publication that promotes personal private care. A founder in the 1970s of the American Society of Preventive Dentistry. Founder and principal of NAPILI, a popular international seminar series initiated in 1963 and continuing to encourage successful private practice fee-for-service. Undergraduate degrees and doctorate from the University of Minnesota, holds licenses to practice dentistry in Tanzania, East Africa, and the islands of the Pacific Rim. A pioneer in group dental practice in the United States with a team of 3 dentists and 4 hygienists, consistently serving the community for 30 years. Since 1989, pioneering the concept of the one-to-one future of our profession and solo delivery system. Concepts such as the single chair schedule, the care pair team, the front deskless office, advanced interactive diagnostic technologies provide the database for the future. A firm believer in his chosen spiritual commitments and family values. An Eagle Scout, a strong supporter and participant in the youth program of scouting. The year 2000 begins the 43rd year of fun in practice and the 47th year of partnership with Marcy. These are among the highly valued experiences of life. You've been practicing dentistry for 60 years.
60 years, not 47, yeah.
Yeah, 60
And I've been
years.
married for 64.
What was harder, dentistry, 60 years, or Marcy, 64?
I tell you what, there's nothing ever been harder. I get up in the morning, I have feet hit the floor, and I say, hot dog, I get to go to the office. And Marcy's been a tremendous partner and a great support, and she is a good cook, and she's got lots of money. So I mean, and I'm inherently lazy. So there you go.
You, I remember when I got here in '87. I mean, when I got out of school in '87, you were the biggest name in dentistry. No, you really were. I mean, every time I lectured for 10 years, they'd say, "Where are you from?" And I said, "Phoenix." They'd say, "That's where Omer Reed is." And I say, "I know." And Omer, it was you were so gracious with me. I remember in '87, I saw an article you'd written, and I think it was Dental Economics, and I looked up in the yellow pages, found your address, and thought, well, I'm just going to drive by his office. I'm going to see. Drove by, you were there. Let me in, answered all my stupid questions for hours and hours and hours. I saw you so many times, and you were so available, accessible. You've seen a lot of changes in dentistry in 60 years. Yes. And I wanted podcasters, people who listen to podcasts are usually millennials born after 1980. They're multitasking. They have an hour commute to work. They don't like to listen to all the radio and all that stuff. And they're they're probably 25% of them are still in dental school, and the other 75% are under 30. And I was hoping you could give them a 60-year historical perspective of dentistry, since they're still in dental kindergarten.
Yeah, there's a lot of myth about the changes in dentistry. It's a school debt of $400,000, and it's either that or go join the corporates, which both are a slavery that the dentist can't afford. If you owe $400,000, it's going to affect your examination, your diagnosis, your treatment plan, your fee schedule, and your case presentation. There's just no question about it. Subconsciously or otherwise, it's going to be there. And so is corporate dentistry, only that's even worse, because now they tell you what to do and they pay a little bit, and that's about all there is to it, you know. And so I would say to these guys that the myth of private personal care, single chair schedule, I refer to the Kellogg Educational Study on dental productivity for that single chair schedule business. The data showed that the dentist with a single chair with a good case presentation where he diagnosed and treatment plan and presented and then had a financial arrangement before they sat in a chair netted more than the guy who had 4, 5, 6 chairs because of the overhead item and all the other stuff. And the pain in the tail it is for all that gut-wrenching stuff with, you know, all these people running around all the time, wearing out the carpet. So I would say to these kids, I know it's dangerous, and I know everybody's advising otherwise, but if you can find a practice where middle-aged or an elderly dentist is willing to sell, and he's private fee-for-service, which is, I think, extremely important. He's willing to mentor you. I think that you should grab onto that because even if you have to borrow to do it, you already owe money anyway, so what's the difference? I am convinced that dentists do not realize that dentistry is a relationship game. It's a personal thing. It's one-on-one. It has nothing to do with all the things we've been hearing about lately. I'm just very convinced that the dentist who's caring, they don't care much you know until they don't know how much you care. And if you're caring and they sense that, everything goes. There's no problem. So it's harsh advice for a kid because, you know, he's up to his armpits in hemorrhage and money and all sorts of things. I'm lecturing at International Association for Physiologic Dentistry in October for the subject of slavery in dentistry, whether it's the school debt or the corporate. And I've got a very succinct, punctual answer that I think is absolutely nothing short of brilliant. I'll share it with you. This was about 30, 40 years ago. There's a fellow named Rusty Sisson. He was on the board of directors of California Lutheran University with me, and he said one day to me, Reed, he says, I have a gift for you. And he said, but I'll need a half a day. I said, well, I got a half a day today. I don't go to the airport until about 10. He says, good. So we got off and cloistered ourselves monastically in the hotel. And he said, I want to tell you a story. We're doing a lot less than we think we are, and we can do a lot more than we think we can. And we are our own limitation. He said there's a history of a very interesting program that's been tried nationally twice, internationally twice. The United States was the one that selected to do this. It was the Manhattan Project and the moonshot. Hitler had a heavy water plant in Norway, and Einstein had told Roosevelt in the 1930s that they were working on it, and we didn't know where they were, and it was a little scary. It's sort of like North Korea. Anyway, the other one was moonshot, and now the Russians have a nuclear weapon, and they got a satellite up there going beep, beep. And they can put one of those things down your smokestack anywhere you want, and we knew that. That's not fun. So Kennedy says we're going to put a man on the surface of the moon and bring him back alive by the end of the decade. Those are objectives. Going to put a man, we know what that is, on the moon, we know where that is, and bring him back alive. That's a very important thing within the decade. And it was his plan to outfinance Russia, and the Cold War speaks for itself. What I'm telling you is that the project is got a threefold part to it. Number one, you have to have an objective that's unachievable by ordinary means. That was the moonshot and the Manhattan Project. We knew where the moon was, we had the gravitational loads, we had the distance, we had everything, but we didn't have the fuel of the vehicle. And our answer to that, when we got to brainstorming, was absolutely nothing short of brilliant. Landing and having and coming back, brilliant, absolutely brilliant. And of course, we beat Hitler with the Manhattan Project, and there have been some arguments about whether that was good or bad, but nevertheless, those two things show us that nationally there is a chance for this program to work. Selecting an objective is unachievable, whatever it means. And that's already happened for the dentist. He's got a $400,000 school debt, or he's going to go to the corporate. Those are, situations that fit that first criteria. The second criterion is equally as mind-bending. You go out into the future and work back from the present, that time to the present to generate your plan. We're all pro forma people. We find out what we have, we're going to lug that forward and see what we can do with it. And in 10 years, you don't do much of anything. At age 65, the Dental Association study, ADA study, shows that 95% of the dentists do not have enough net worth to retire. And of course, that's true of the general population, but it shouldn't be true of the dentist. And that is absolutely sinful, because we handle a lot of money and we're in a position to make decisions. So, working back from the future, you'd go out there and decide this is what it's going to look like when I finish. I'm not going to owe $400,000. I'm not going to be in the corporate, boom, boom, boom. And you come back day by day, week by week, month by month, till you get to today, and now you know what you have to do today. and tomorrow and the next day to get where you want to go. And you've got that plan. And then the third thing is to monitor. Now, we don't do that very well in dentistry. In fact, we don't do it at all, really. Kellogg Foundation showed that the average dentist had no idea what his production was per unit time or what kind of downtime he had or anything else. So he gave, I'll tell you about that study in just a minute, but they gave us a real gift when they said, we have data to show that you are going to be ahead if you slough your overhead and do your job right with the person's relationship, and then collect the money and you're all home free. Well, the two instances, the Manhattan Project and Moonshot, were fueled, they were motivated, they were driven by fear. We were afraid of what had happened to the Russians, that they poked one on our chimney, and we didn't like the heavy water thing with Hitler. Heavens, if he'd have gotten that weapon first, your life would be different today. Anyway, so fear is the driving motivation, and I don't care how young or strong you are and how much money you married. By the way, you can marry more money in 5 minutes than you can earn in a lifetime.
I remember that, Ryan.
Fixing teeth. Anyway, it's an amazing phenomenon because we don't monitor. Now, you'll be intrigued by the Kellogg study when I tell it to share it with you. It was published in the 80s in the ADA Journal with a bunch of data, but nobody ever reads that anyway, unfortunately. Whatever. Monitoring is marketplace productivity and finance. Where do you want to go? What do you want to do? And how much of it do you want to do? And we're going to get the money to do it. Now you can analyze before you make your first step all the things that are going to stand in your way. And monitoring is a critically important tool that has to be mastered. You have to want to do it. It's not easy. You have to have some people come in to help you with it. I know that when I did the study for timing with the stopwatches in the chair, my team couldn't handle it. Mrs. Jones sat in a chair and we'd forget to punch the watch. Say, oh, she's been here 5 minutes. That's not good enough. You want to have the absolute data. So I hired a high school girl in the morning, one in the afternoon, and they came in and sat with a stopwatch in my operatory for a whole year. And let's go into that study just for a quick second because I think it's critical. Kellogg called me, this is 40 years ago, and he said, one of the guys said, we'd like you to be a motivational speaker for a workshop we're doing, and this is a seminar we're going to document, and so it's very important to us. We'll pay anything you want. We'll fly you from Phoenix to SeaTac Red Line, and we want you to speak from 8 to 9 on Thursday morning and 4 to 5 on Saturday afternoon. And the theme is why you should do this, and the theme is why you should not stop doing it. And he said, when we're all finished with this, we got 30 guys. A third of them are less than 5 years in practice, a third of them are 5 years or more, and the last ones are seniors. A third of them are from rural Washington, and then from Seattle there's a third, and there's a third from sub-Seattle, the subdivisions. And he said, so we've got a real diverse group, but he said, one guy drops out of 30, it affects our statistics rather sharply, and we can't afford that. I said, what is the secret you're going to tell them? Well, we're going to tell them a secret that'll double their gross product, the net product, without changing their fee structure or their time at the chair. I said, you shouldn't need me. I mean, anybody with that kind of promise ought to be sticking around. So I said, I'll come out and take a look at it with you. And so first Wednesday I flew out. Thursday, the big guy gets up in front of the group. The team was there, the doctor was there, 30 practices. And he said, what he just told me. And he said, I'm going to introduce Dr. Reed. He's going to tell you why he thinks you ought to do this. And I went into a few things like, it would be absolutely insane not to do it when you're going to get a secret that'll double your net without changing your fee or your practice hours. I said, you don't need me. And then in the afternoon on Saturday, I sort of dwelt on the same theme, but I made him feel bad about leaving because of the statistical difference that it would make in the study for Kellogg and all that stuff. And they're having all their bills paid at the SeaTac Red Line by Kellogg. Everyone was given a 3x5 card, and it was the person's name, the person's time in the chair, the person's procedure in the chair, the doctor's time in the operatory, the doctor's time out of the operatory, and the fee. Those are the objective things that were measurable. So with the stopwatch, Mrs. Jones sat in a chair, and then when she got up, you punch the button again, and That's her timing. Doctor walks in the room, punch a watch. Ooh, doctor walks out of the room, punch the watch. Well, that went on a dozen times, many times, because the guy was coming and going, running down the hall for 3 or 4 other chairs and spreading himself thin and running his gut to the wall. I was really excited and impressed. He said, now, if you want to stay with the study, you can do that. You can be number 31 on the... So I said, you're on, I'm going to stay. We came back after the first year, and he said, we're going to send all the data that you send us, those little cards. Every 3 months, we're going to send them to Kansas. That's where the database is at the dental school. And at the end of the quarter, we're going to give you your best last average. So you know what the time was for the procedures you did. And we'll have to do some fiddling around a little bit to get the figures, but to fit, because you do several things at the same time, but we'll work it out. So I did it, and they did it. And we all came back year one, a year later, to CTAC Red Line, and there wasn't a single one of us that hadn't doubled our net that year. Now, if you're doing 200, that means you're doing 400 net. If you're doing 8,000 net, 800 net a year, a month, you're doing 16. That's a nice multiple. Anyway, I was impressed. I thought, wow, this is something else. The second year, he gets up in front of the group. We got 3 days with him, and he's giving us all sorts of pep talks and instructions and blah, blah, blah. And then he said finally, well, you number off 1, 2, 3, 1, 2, 3, because there's 30 of you. And they did. And I said, well, all the ones, please stand up. And they all stood up, the team and the doctor. And he said, does it feel to be a number one? and everybody smiled. And he said, now, you're our control. We're not going to tell you what the secret is, but we're going to let you go now. And we don't want you to try to get the secret from the guys we're telling this year. And next year, when you come back, we'll tell you the secret. But in the meantime, we'll monitor it just like we have in the past. That'll help some. Well, I was impressed. They left. 10 doctors and their wife and their teams. And it got real nice and quiet in there. And he said, the secret is, now you know exactly to the second what your productive per unit time is and what the net on that is. He said, take your gross last year and subtract the costs, your overhead. And now you got your net. Divide that by the days, weeks, month, hours, days, minutes you work, and you got a piece of data that you never had before. Blow your mind, he said. It'll blow your mind. Well, it blew my mind. Anyway, make a long story short, at the end of the second year, we all came back, and of the 21 of us, there wasn't a single one of us that didn't double our net again. Now, that's impressive. That's really impressive. And all it was doing is bringing the attention of the dentists to what was really going on in their life. They knew how to do it. They just didn't know when and how to do it. And so Kellogg was saying, you got to mend your ways. And he said, I can show you the data. If you've got 6 chairs and 6 operatories and a bunch of women running around, your overhead is going to destroy your net to the point where one chair with one doctor with a case presentation arranged and presented and financially arranged before they get in the chair is going to out-net them by almost twice. That's staggering. Well, he made a believer out of me in a hurry. And I had my best years after that. So I would advise the young dentist, back to the dentist again, to think about these things. Maybe look up the old the Kellogg study out of the 88 journal. I think it was 85 or 86, somewhere in there. And find out what the details were, because that's the only time it's been done. That's the only time that kind of thing has been done for us. And boy, do we need it. I mean, we really need it. So the Kellogg Education Foundation study, the Manhattan Project Moonshot, that's model building, are 2 of the big tools that I think are absolutely, totally essential for the dentist, new or the one that's practicing. I'm going to get up in front of these guys down in Las Vegas. I'm going to say, look, we got a bunch of guys in here with $300,000 to $400,000 debt from school. We got a bunch of guys in here with $300,000 or $400,000 debt for buying technology that doesn't amortize itself. A lot of it does not amortize itself.
Can you explain that? A lot of these kids don't know what amortizing is.
Okay, I bought a RBG in 1982 from the guy in France that designed it and built it. I was over there lecturing and I ran across it and he said, holy smoke. I said, send me one. He said, send me $30,000. I sent it to him. I got the machine. There was no dealer here, no repair, no anything else. And I hooked it up and it operated flawlessly.
What was it?
Radiovisiography. The thing is, you take the picture with the mountain, it develops instantly on your computer in front of you. And I said, now I know what time it takes me to get a film back for diagnosis, toothaches, emergencies or whatever, or my other information in the practice. So I'm not going to take the bite wings and the hygienist and all that other kind of stuff, just mine. And I'm going to add those minutes up and find out how long it takes for that thing to pay itself off. Well, 11 months later, I had my money back. That means that the opportunity cost, that happens to be what you lose if you don't do this thing, is, $300,000 in 10 years, because that thing is earning you money. And that's amortization. Now, I can name off and rattle a bunch of hardware and technology right now. Many of it's backordered even, because so many guys want it, that cannot amortize itself in your lifetime. You can spend your entire life working with it, and you'll never actually break even. Now, that's pretty insane.
Can you name those technologies?
Huh?
Well, say which ones they are.
Well, I think that would get me in trouble, wouldn't it?
Well, when have you and I not been in
Well,
trouble?
for 5 years, I had a beta site for the technology that Francois Ray developed
Serac?
with CAD/CAM. I did it. Mrs. Jones called me from Chicago one day. She said, is it true? And I said, yeah, it's true. She said, well, every time I get an impression taken in my mouth, I go absolutely absurd. She said, I can't handle it. I get internal claustrophobia. Can I come out to Phoenix? I said, sure. I said, when are you coming? She said, when do you want me? I said, anytime next week. She said, fine, I'll be there at 9. And she said, how long will it take? I said, what's your flight home? And she said, well, it's up to me. And I said, take the 3 o'clock home back to Chicago. She came in and she had an old endo that was treated and needed to be crowned on the lower right side, first molar. And I explained to her that this was going to be painless and simple. I didn't have to inject her, which is not something that's a problem for me. But we prepped the tooth, took the pictures, put the block in there, push a button, and an hour and a half later, we put it in the oven, glazed it, cleaned it up, and seated it, and it fit. And she was just ecstatic. She almost wet her pants. Anyway, she said, oh, wow, I've got to pay you for this. How much is it? And I said, how much would you have had to pay for a crown in Chicago? She says, $1,400. I said, oh, okay. And she says, this is worth twice that to me. She wrote me a check for $2,800. I mean, that kind of thing is okay. But if you add up the time I spent and the team I spent and the investment I'd made, try to get that all back, it wasn't coming. There's no way to amortize that. And Serac's even worse. And that's not as accurate. And it's just a painful thing to see my colleagues becoming computer dentists and laser dentists and all that stuff, when the data does not support a lot of it, and the equipment is very expensive. So I'm going to talk to 2 groups of guys: the guys that own school debt, the guys who own utility debt on there, and I'm going to give them the model building thing. I said, can you imagine what you're going to be like when you've overcome that debt? And I said, let's talk about my old friend Viktor Frankl, friend and mentor. He was here in 1990. I got to know him fairly well. He was in Auschwitz or in several prison camps for about 3.5 years, wrote a book, Man's Search for Meaning. And he left me with 2 things that have been absolutely terribly important in my life. Good for the kids, too. Number 1, you have the right to choose until your dying breath what attitude you bring to any given situation. That's a choice. Use the word choice. Don't forget that word. And he said the second thing is, in the prison camps, it wasn't the young, strong, and beautiful that survived. It was those who had an unconditional to something in their future. Unconditional commitment. You put those 2 words together and think about what they mean to you. Very few of us have an unconditional commitment on anything. Even marriage these days seems to be sort of a rocky deal. Anyway, those are the 2 things that have been very valuable to me. The deaths of my children. It's up to me to choose what attitude I bring to that situation. I can be grieving still, if I wish, or I can be thankful for the 58 or 60 years we had with them. We had 5 kids, we had a big family, we traveled internationally a lot. It was a great life. They had a lot of humor. They were very successful. And I mean, what a thing to be thankful for. And I should bellyache and bitch and moan and groan because I lost one. Well, we lost 4 of the 5. Carrie's still alive, my hygienist. She's 54 and working her head off, but and having a good time.
I drew so much strength from you watching as your children died. You were Batman. I mean, you held it all together. If one child dies, 90, it's like 91%.
1980.
No, but 90% of marriages fail.
Oh yeah, on the first death.
On the first one.
Just like that.
And you and Marcy survived 4.
That's right. I've given her the choice. I said, maybe you ought to go find a good-looking guy with a young body. You didn't sign up for this. And she smiles and says, oh, yes, I did. Which I think is the kind of commitment you don't see these days. Unconditional commitment to something in your future. And now, if you can change your entire view, which you have the choice to do, and actually decide that you're not going to see the debt as a millstone around your neck and you're going to be thrown in the river, but as a blessing, as a driving force like the Manhattan Project, the Moonshot, that absolutely created change that's unbelievable. And we need that kind of drive in dentistry. So I'm convinced that Frankl was really a giant in my life with those two things. And I think that our young dentists need to have that.
But Omer, you and I have seen this corporate rodeo a couple times. Back when I first met you, Orthodontic Centers in America was publicly traded. They were going to build their own ortho schools. The orthodontists all saw doom and gloom. There was a dozen on NASDAQ. They all went under. They disappeared for a decade. Now they're back. And do you think they're back to stay this time? Do you think where do you think dentistry will be in 20 years?
Well, that's up to the individual dentist. If he decides that he's going to be interdependent with the people coming for care and his family, not independent, interdependent, then that's an unachievable objective in his future that is unconditionally worth his commitment. And I think he can pull it off. So it's one practice at a time to survive this corporate thing, which I think is an astonishing what's a good word? An astonishing accident, for one thing. You can't live on $1,000 a month or a week, or $100,000 a year.
I mean, we live in Phoenix where they buy $1,000 iPhones.
Sure.
What percent of Americans do you think want low fees, high volume dental clinics, and what percent do you think want low volume, high personal care, higher fee?
Well, there's a group of people called the Class 1 Triple Plus. Pankey delineated what they were like. Educated, motivated, successful financially, all these other things. And they're not stupid. They are not stupid. I had a practice filled with Class 1 Triple Pluses. They were just absolutely wonderful people. And it would take 2 or 3 years to transfer the trust from me to the buying dentist in a situation of transition, right? And I believe that the percentage of those people, now, I don't see Class 4 chronic adult periodontitis anymore in my practice. I can go to South Phoenix and find it when I go to St. Vincent de Paul or something. But I said, none of the people in my practice have that. In fact, running into a bleeding gingival crevice once in a while is a miracle. I rarely see that even. And of course, Radcliffe, one of my real strong mentors, said bleeding is not good, oral systemic connection and blah, blah. And so I'm very happy that these people have captured the interceptive preventive game and that they're doing it.
Now, Perry's son is now running closest.
Yeah, well, he's been released from his job at the university, and this is sort of his, what do they call it, bread bowl or bread basket. And in my opinion, he's doing a very poor job, but somehow they're getting it into some of the stores, and Southwest had a big ad in the paper, in their magazine last month. I mean, things like that are beginning to happen. If the people of practices around the country, and if the dentists and their hygienists knew the efficacy of that product, everybody would be on it all the time. Because it's bactericidal, it's detergent, it takes away the dead cells, that sick tissues like to live on, and it takes away complete sulfur compounds, volatile sulfur compounds, so there's no breath problem. Right down the line, this is a fantastic.
When did Perry pass away?
4, 5, 6 years ago.
4, 5, 6 years.
Yeah.
What an amazing man.
He was.
I remember the first time I called him up. This is back in '87 too. First time I ever called him up to ask him a question, he said, "You know what? That's a long answer. Why don't we just do dinner?" And I thought, wow, he's gonna take this dumb punk kid to dinner. And I think we closed the bar down talking about periodontal disease.
Yeah, he's an amazing guy.
You and him were both founders, because you were a founder of the American Society of Preventive Dentistry.
Oh yeah.
I mean, that back in the day, you started that in 1970. I think you had like, what, 8,000 dentists back in the day?
It was absolutely amazing. It was like leanings to the sea. I've never seen anything like it in my life. The idea got out there, and we're going to have a national meeting, and they showed up like, it was amazing. And their team was with them. It was just one of those amazing things. And it was an adhocracy. We designed it as board members to get one thing done, and when it was done, we're going to dissolve the organization. We weren't going to go on forever like most of these clubs. That objective was to get the word plaque into the soaps, into the homes, into the dental offices, and the hygiene hearts around America. Well, we got that done in about 5 years, but there were two guys struggling and wrestling for the chair, so that we have still running 7 years later. 7 years, we ran 7 years.
His message is lost to this generation because he's not on YouTube.
It's not in the dental schools, it's not in the postdoctoral courses.
I bet in your garage, attic, basement, doghouse, somewhere, you might have a video. I don't even know, we'd probably have to go buy a VCR. I mean, we don't even have a VCR, but I'm telling you, it just makes me sad that if you Google him on YouTube, there's nothing.
Yeah, that's right.
There should
and
be.
You go to a lecture group like I'm going to be in October, I say, how many of you have heard of Bill Dickerson? All the hands will go up. How about Howard Farran? All the hands will go up. I said, how about C.C. Bass? 1 or 2 hands will go up. How about Sumter Ernham, University of Texas periodontist? How about Nate Friedman over at USC periodontist, psychiatrist, medical doctor? What a combination, huh? And no hands will go up.
I just got an idea. They're all kids listening to me, but about a third of the dental school class, their mom or dad was a dentist. So your homework assignment is, if you're a young dentist and you have a dad or a grandpa or a grandma that's a dentist, call them up and ask them if they have any old VCR tapes of some of these dental legends.
What are you looking for?
Everyone you just named?
Well, Barkley was lecturing in early 60s in Tucson, so I took my team. There were 3 doctors and 4 hygienists. We were sitting in the front row, we could get all the saliva. And he's introduced graciously. And he's sort of an unknown at that point, but he gets up and he adjusts his microphone a little bit, and he looks at the audience and is quiet for, I'm sure, not more than 20 or 30 seconds, but it seemed like an eternity. Didn't say a word, and then he finally looked at everybody and he says, "You guys are absolute prostitutes. You're absolute whores. You take care of the effects of disease and leave the known causes working." And he says, "That's amoral." It got quiet again for about 30 seconds. You could have heard a pin drop in there. Nobody's talking that story anymore. But boy, is it true. Now, those people that I see that you asked about, how many want care, if they come to me, the first thing they get is this preventive thing. How to floss, where to floss, we stain them. And we show them that the floss has to go between the teeth, and then it has to take the loose end and come around the lingual, so you can shoe shine the lingual of the tooth. And since the tooth is tapered, cross the floss, take a short grip and a very short stroke, and the floss will slide down the tooth to that 1/2 millimeter into the gum where the plaque is as well. That circumferential flossing is Radcliffe, and nobody's talking about that anymore. That's for damn sure. So I tell them, they say, "Well, I floss." I say, "Okay, show me how you floss." And they go, "Ping, ping, ping," and maybe a piece of food flies out. Well, that's good. But it takes 7 or 8 days for the food to ferment enough to be a problem. And if you have your teeth cleaned and you don't get the plaque off daily, 3 days later you might as well not have your teeth cleaned, quite frankly, bacteriologically. And Radcliffe was overwhelmingly encouraging in that regard. And he was teaching cell biology to his hygienists. He had 5 hygienists. He taught collagenous reattachment, where you root planed, and then you citric acid and tetracycline the root to prepare it, and then you brought the fresh created tissue back against that, and you did that 2 or 3 times in maybe a 3-4 week period. And over an 18-month period, you watch the bone come back up over the furca even as the tissue climbed up that too. Now, nobody's talking about that anymore either. And Carrie had that training, and that's an interesting story because she's no stoop. She's really a bright, sharp, able lady. And when I sold the practice, I had a dealer that was doing some due diligence, but they didn't do a very good job. And the guy was very nice. We got along nicely. He was there for 5 or 6 months. I gave him some dental shirts. I sent him to my barber to shape him up. And, he started to look like a dentist. He was a real generation hippie from back one generation. Anyway, that was great. Then his wife came to town. She'd been in Philadelphia selling the house. And the second day, he came to me and he said, my wife tells me that your daughter is unmanageable. She's incorrigible. What am I going to do? And I said, well, Jim, I said, seems to me you bought and paid for the practice. I've got the cash. It's your business. You can do anything you want to do. Why don't you fire her? Thinking that that would be the most absurd, idiotic thing for a dentist who's assuming a transition to do it with a hygienist who's been there 25 years. Give me a break. She's the umbilical to the whole thing. And that day, his wife came over and says, Carrie, you're out of here. We don't need you anymore. And so Carrie came to me and she said, what am I going to do? I said, find somebody else. And my sister Naomi has a daughter by the name of Beth Harmon. She's practicing on 32nd at Indian School. Graduated from Loma Linda. Now, Loma Linda is one of the 2 schools that's still behavioralistic. They're not like the Marine Corps. They tear you apart and rebuild you in 4 years. They try to take the rough edges off, but they want you to be present. They want you to be humanistic. They want you to be caring, and they want to teach you how to empathically listen. Empathic listening is extremely pregnant for the young dentist. Write that down. Empathic listening. Anyway, make a long story short, she was invited to go one day a week over to Beth's office. Carrie was. She went over there and she said, I like it here. And Beth says, I like you here. So she put her on full time. Well, over 3,000 of the people in my practice followed Carrie to that practice. So Beth inherited the practice without having to pay for it. And Carrie's just happy as a tick because she's working with a person who's behaviorally very, very coaching, and she's also very able to help with the cell biology that Beth didn't get. So it's important that these people are cared for properly, and they're going to find the right place. If the guy doesn't cut the mustard, he's out of there.
But what are those? You said caring, empathy. What did you?
Listen empathically.
Listen empathically.
Yep. Not how long you listen, so fast you hear.
Say it again.
Not how long you listen, it's how fast you hear.
It's not how
long you listen.
It's how
fast you hear.
When you talk about relationships and listen emphatically, they come out of school, they think, well, if I want to be a great doctor like Omer Reed, I need to go buy a laser and a chairside milling unit, and I got to go buy. If I don't have all the expensive bells and whistles, then I'm not validated. I can't be a good dentist.
That's right. Well, I disagree with that. If you walk down the street and you meet somebody nicely dressed and they look at you and you look at them and they smile and you smile as they pass by you, you like yourself better while you were with them that split second. You like yourself better when you're with that person. I think that's a critically important thing to understand. When the person comes in for dental care, they want somebody who listens and understands, and if you want to make sure that they know you understand, you feed back what they said in your own language. My father used to say, I know you understand what you think I said, but what you heard isn't what I meant. And he's right about that, because...
Say that again, that was too good.
I know you understand what you think I said, but what you heard is not what I meant. So the meaning is the important part of it. And so if you say back to the person in your own words what you think they said, they say, oh no, that's not what I meant at all. They clarify, and now that same thing like walking down the street, you can fall in love with a person in seconds. They'll walk in as a new person in the practice, they're hooked. Because we care, they know it, and we have nothing else in our minds. We're present, And we're welcoming them, and we're glad they're here. And in fact, I think they're fortunate that they're here, because there's some things they don't know, and they need to know.
But Omer, in all fairness though, you have a magnificent personality, charming, good looking, tall, handsome. You're the whole bag of chips. These kids got accepted in dental school because they got A's in calculus and chemistry, and they sat in the library every night until midnight, and they got a perfect score on their DAT exam, and they're afraid of their own shadow.
Right.
So my question is, can your personality, like a movie star, you know, say a movie star is playing a character, maybe they're a bad guy, a good guy. Can a dentist become Hollywood and act like you during the day, and then when it's 5 o'clock, just go home and crawl into his library?
Yeah, when the person comes in for care, it's showtime. Bingo, right now. And you're there present with them all the time, listening, watching, and paying close attention to the things they want and need. And you let them know that that's true.
And he said something very important. I just want to repeat it because I don't want to fly over your head. What dentists do wrong is when they ask a question, the patient will answer, and they go right to the next question.
Yeah.
With humans, if you don't repeat back what they said, they don't think you heard it. He said, well, he asked me 10 questions. He didn't even listen to me. And they do it in spouses, too. When your wife's yelling across the room and she's telling you stuff, you're like getting, okay, I'm going to take out the trash. I'm going to do these things. But you're not repeating it back. So she's in there thinking, he doesn't even listen to me.
She's not concerned about you hearing what she said because she doesn't think you're listening. Yeah, it's not how long you listen, so fast you hear. And I think that dentistry for 60 years was a real adventure, a lot of fun. I was at the top of my game, and I hated like sin to be physically retired by my open heart surgery, my valve replacement. And then I came back and I worked.
Do you have a dental office you can play in if you ever needed something?
Oh yeah, I got several I can do that in, but I've got a covenant not to repeat, so I have to be careful of that too. I'm somewhat kosher, but St. Vincent de Paul has invited me, and I know the people, I know the team down there. You got a brilliant clinic.
I want to tell you something that tell your friend, he's the head of the St. Vincent de Paul.
Yeah.
I really want to podcast him.
Oh, you got to get him. He's really a brilliant man. They just won an international award against some of the big corporates.
Yeah, what's his, Ken what?
I'll give you the numbers before you go.
Okay, but I'm going back to nostalgia things like back in the day when the owner sold the practice, the owner carried. So for the 7-year note, the owner if you defaulted 39 days, you got it back. But he had financial incentives to mentor you, to help you, to spread goodwill. Now, owners don't care. They all go through the bank. And I think it's, I've seen in Phoenix where somebody sold a $1.5 million practice doing full mouth rehabs to some punk out of school that couldn't sell half of that. So he bought a practice, I think, doing like 1.3, 1.4, and it did like 600 the next year. I've seen, but I think that the ideal situation for this young kid is go back and go find some dentist that'll carry the note. Do you agree with that or disagree?
Well, there's a commitment there.
Or at least half the note.
I was invited to stay for 3 years because I'm doing a lot of neuromuscular stuff. I had 80 people in orthotics, and they require, some of them, most of them, full mouth porcelain coverage to make up for the wear and tear and the destruction. So I was, and he doesn't know schmool about that, so I offered to stay. And I took him to Las Vegas Institute. I gave him the tuition, round-trip airfare, and hotel for the first of 7 core meetings to learn how to be a neuromuscular or physiological dentist. I left my K7, that's the big jaw tracker, hanging on the wall. I was in good shape, and I left all my other stuff there too. When I left, I got fired the next week, by the way. She came to me, she said, Dr. Can I talk to you? And I said, sure. She said, come on over to my desk. So I sat down. She says, we own the people, we own the scheduler, we own the chairs and units, we own the ceiling and the floors. We don't need you anymore. My answer as a good Christian gentleman was, well, thank you. I needed to know that. And I smiled and I left. She said, I want everything off the bookcases and off the walls by tomorrow at 4. Well, by noon that day, it was all completely, looked like somebody flushed a toilet in there. Anyway, So I was invited to stay for 3 years, and that got canceled because this guy's wife was.
Yeah.
Yeah.
Yeah, I'm sorry you had to go through that. That's so. How could an introvert, shy kid learn to be more listening empathetically? I mean, Omer, when I was in your office so many times, your patients loved you. I mean, you're that guy. I mean, you really are. You're the whole package. Tall, dark, handsome, all this personality. How does a young 25-year-old become a leader? How does she develop?
Go to Toastmasters.
Toastmasters.
Go to Toastmasters. It'll take a year or so before the rough edges are gone, but pretty soon you become articulate, confident, self-focused, which you need, and maybe a little egocentric, and that doesn't hurt either. I think that's the way to do it. And then you should find a mentor or two, people that you respect that have the care, skill, and judgment built in, that are willing to share time with you. Radcliffe, C.C. Bass, trying to think of that Michigan guy. They did some interesting studies in perio on the 4 different types of surgical procedure were going on at the time. Full surgery with bone reduction and all this other stuff. And he found out that root planing and curettage, like Radcliffe was doing, followed by careful follow-up, would reduce the necessary need for surgery and reduce the severity and critical nature of that surgery. And I was impressed with that.
I got another question for you. Let's go back to Perry Radcliffe. He was a periodontist.
Yes.
Of all the specialties, ortho, pediatric dentistry, endodontics, oral surgery, I mean, perio changed the most. So when I got out of school 30 years ago, it was all this gum surgeries and root planing and curettage. And then after about a decade, there was this new magic titanium thing where you don't have to deal with any of that crap.
Out goes the root.
Pull the tube, fix that perio with titanium. But now, 30 years later, people are saying at 60 months, 5 years, 20% of the implants have periodontitis. And now I'm starting to see the pendulum come back that maybe that titanium isn't a cure for everything, and maybe some of the good old-fashioned periodontal stuff is coming back.
Yeah,
so where do you see that?
Well, the holistic dentists, there is a group of dentists that are very holistic, and they believe that the ceramic implant is better than the porcelain metal because of the metal. But you know, ceramics, whether it's self-cure or whether it's lab cure with a glaze and everything else, they also dissolve into the body and into the bloodstream. There's nothing sacred. Water is the...
I know, and they say, well, I have to use this porcelain implant for because they have metal allergies. Like, dude, the porcelain's a metal.
Yeah.
I mean, they're using metal implants.
Sure is, yeah. No, life is strange and unusual, isn't it?
Yeah. It's very strange.
Yeah. Well, I tell you, I'm very happy that I met Radcliffe. I was in the Air Force, 1957. And the general called me over to the hospital. And the colonel and there 30 of us in the building said, "Reed, what'd you do now?" I said, "I have the slightest idea." So I get over to see the general. It's a 1-star general, Dr. Lee, medical doctor, runs a hospital, runs the dental clinics as well, of course. That's his business. And he says to me, "You're from Minnesota?" And I says, "Yes." He says, "You do inlays?" I said, "Yes." He said, "My daughter's coming for 2 weeks. She's got 18 complex MOD buckling amalgams, and they're all crumbling, and we want them out of there. Can you do the inlays for her?" And I said, "Sure, I'll prep them and send them all off in the hydrocolloids and pour them up and get them back and seat them and finish them for you, and that'll be fine." So as luck would have it, I got those inlays all back, every one of them complex fingers and all sorts of box forms and retiniform, everything fit like, and the occlusion, this lab that I had up there was just nothing short of genius. In fact, 7 of those guys came down to be with me to start CeramDent back in the 60s. Anyway, Christmas came and went, and his daughter went back to school. And she was happy, of course. And then one day he called me over again, and the colonel says, "Oh, crap, what did you do now?" I go over there and he says, Reed, he said, you know what TDY is? I said, no. He says, well, that's temporary duty, where we cut an order for you and it tells you what you can do. And if you want to go to USC for a course for 10 days, you sign up for it. And if we approve it, all round-trip airfare, hotel, and meals for you and your wife, and the tuition and the hotel, everything, all paid for. So I said, okay. And I said, I've got a course I'd like to go to. He said, well, let's sign you up. And I signed him up. He says, any course you apply for, I will approve. Well, I went to 22 postdoctoral courses on that promise in the next 20 months. And one of them was Radcliffe. I walked into Radcliffe's, I still have my uniform on. And he looked at me and he says, Captain Reed, he said, he realized I was sort of a cocky rascal. He said, when you get back to Amarillo, you're going to find that every troop who sits in your chair has contracted this rare malady in your absence. And he smiled. Boy, was he on the money. Oh, man, I tell you. Anyway, then he finished his 2 or 3 years as the head of the Department of Perio at UC San Francisco Medical Center. Came to Phoenix because he had 3 study groups here with 8 or 10, 12 guys in each group. And he liked it here. So he came here, and these guys, of course, became tremendous referral sources, and myself included. And they moved here, and he started practice, and that's the rest is history. The guy taught courses here, and I attended them all. He was an extremely, tremendously capable tissue biologist and cell handler, and he also was a friend. He would correct me without any apology at all, and let me know that I was wrong. And he expected me to say, I'm sorry and I apologize, please forgive me, because that's the result of what happens when those things occur. And I did, because that's my nature. And we got along fine. I almost re-enlisted. I had a parachute down the flight line, and I had ridden the ejection chute, and I had a helmet and the whole darn yard. So I'd fly over to Phoenix instead of driving my Buick over here.
I only got you for a couple more minutes. You are just as popular in the United Kingdom as you are in the United States. You've been on the editorial board of the Independent Dentist. It seems like 30 years ago, all the dentists worked for the NHS.
Yes.
And they had to lower the fees until dentists started going bankrupt. They had to go bankrupt.
That's right.
Before they did this single chair thing you're talking about, which now there's like several thousand of them. But the majority, and I see the same parallels in the United States, because in Phoenix, Arizona, where we are right now, Delta of Arizona used to pay $1,000 for a crown and $1,000 for a root canal 30 years ago. Now it's $650 for a crown. So the fees have gone down 40%. So these guys are running faster and faster and faster. Do you see any parallels to the NHS in England and the PPOs in America?
Absolutely, absolutely. They are administratively enslaving. And you want to be a dental slave, sign up for one of those, or face your debt like it's a millstone around your neck.
Ryan, which country did we lecture that we had the most Omer Reed fans with a one-chair facility?
Oh gosh, one-chair facility. Was that the,
Do you remember?
was that Singapore?
Very good.
What was it?
Singapore.
Oh, yeah.
Singapore, I had more dentists credit you. They're saying, well, I mean, if you want to just follow the insurance in Japan and NHS and America and run 5 chairs and pass out for free. And I heard this guy named Omer Reed, and he actually told my dad. But anyway, they're saying, forget it all.
Yeah.
They're just getting a room the size of this with one chair, a nice, adorable assistant that can take the phone.
Big windows.
They have no overhead, and they'll do like $650, or they'll do like $500 and take home $350.
Yeah, figure that out.
And then the person that's running 6 chairs will do like $1.2 million and take home under $200.
That's right.
And those guys are just saying, you know, basically what they're saying is that dentistry is not a game of volume.
No. What you're talking about has a sharp learning curve. I would also suggest that the timid dentist you asked about, and I gave you the answer, Toastmasters, should go through LVI. LVI has a team of people that are extremely patient and very, very knowledgeable academically, and they care about their members. The last 20 years of my life, I was extremely pleased, happy, and very productive because of Bernie Jankelson and LVI preserving his work in neuromuscular dentistry. He came over in 1950 from South Africa, and the same colonel said, you guys, there's a study group in town, if you want to go, you can have Friday off, but if you, because it's a 2-day meeting, Friday, Saturday, but he says, you skip Saturday and I find out about it, you're dead meat. So Hal Goldeneye from Harvard, instructor, young little wiry Jewish fellow, and myself were the two guys that went. Well, it was October in 1958. We got a notice from the study group saying we're going to have an interesting lecture from a guy from South Africa, and we got 3 guests. His name is Pankey, his name is Harold Worth, and his name is Orban from Colorado. Those names meant absolutely nothing to me. But we went, and Jankelson had a shoebox full of radio tubes and wet sponges, and he was hitting the 7th cranial and relaxing the body over a period of 45 minutes to an hour and getting the trajectory so the mandible met the maxilla where the joint and the muscles wanted it to go, not where the teeth, which are dominant, wanted it to go. So you watch for forward head posture, you watch for one shoulder down, you watch for breathing airway problems, and you got yourself a person who is in trouble and they need your help. And that diagnostically is an easy thing to diagnose. Well, I taught Jim about that, and he was pretty fascinated. He went to LVI. He was fascinated. They liked him. But then when he went to try to transfer my K7, which cost $30,000, there was a $7,000 transfer fee and another $5,000 to calibrate it. And that was too much for him. So he went to see Clayton Chan. Now, Clayton's a good friend of mine, and Clayton stayed with the monitor people instead of going with the new one that Bill was using. And when he went to them, he went there because Clayton was using the K7. Well, Clayton says he showed up for one meeting and then we haven't seen him since. So we're talking here about an adventure. And I think that LVI probably is more meaningful in my life than Pankey Institute. I knew Pankey before there was an institute. I think that without question, an institute that is driven by an egocentric person like Bill, which it takes to keep things like that going, is very valuable to the dentist that you described for me, because he needs to catch some of that. That has to be a contagious thing. He has to want to do it. Where does you gotta want to come from? That's a good question, because a lot of guys haven't even thought about it. So they don't know they want it.
Right.
Now, there's a difference between wanting and needing, but when the person comes for care, if we can change the things they want into things they need, we're home free. So this situation with neuromuscular or physiological dentistry, as they call it now, was absolutely a godsend for me.
What's the new equipment that Bill is using now instead of monitor?
It's a small company, and they've worked with Bill and his team to modify their stuff considerably to suit the program. I can't give you the name right now, but...
Well, that was the fastest hour and 10 minutes on Dentistry Uncensored. That was like Beethoven playing the piano.